Pro-abortionists also claim that abortion is necessary for women due to high rates of maternal mortality. Would you agree with that? What's your reaction to that kind of claim?
It's not true based on any science. There are no studies that show that increasing rates of abortion decrease maternal mortality. In fact, until recently, countries where abortion was criminalized and prohibited, and I'm thinking in particular of Chile and Ireland, and I think Cyprus, had the lowest rates of maternal mortality in the world. For several years consecutively, Ireland had 0 maternal mortality at a time when abortion was completely illegal.
First, restrictions on abortion do not limit a physician's ability to treat an ectopic pregnancy, because treatment of an ectopic pregnancy is not an abortion. Anyone who tells you differently is unaware of the facts or deliberately misrepresenting them. With an ectopic pregnancy, the developing zygote implants outside the uterus. Without treatment, this can result in severe, life-threatening health consequences for the mother. In those tragic cases where delivering the child is necessary to save the life of the mother, an attempt will be made to preserve the life of the unborn baby, and if not possible, his or her body is treated with respect, recognizing the humanity of the life which is lost in the separation. In contrast, the sole intent of an abortion is to kill, to end the life of the developing human being. This moral distinction is essential. Treatment of miscarriage is also being portrayed as criminal post-Roe. Why? It involves removal of the deceased embryo or fetus. Elective abortion, on the other hand, directly kills the embryo or fetus. The two goals are entirely different. Elective abortion is always morally wrong. We've also heard arguments that abortion restrictions have disproportionately harmed low-income people, particularly Black and Hispanic people, who are already less likely to have healthcare coverage and who face more obstacles accessing alternative options. There is no evidence to support this. This argument is also incredibly insulting to minority women, because it really says you have only one option: kill your child. The truth? Legalized abortion has harmed minority communities. Since 1973, 17 million African American lives have been destroyed by abortion. The abortion rate among Black women is 3 times that of white women. And in New York City, for example, more Black babies are aborted than are born. The U.S. maternal mortality rate is the highest of any developed country, but abortion won't change that. Black women, who have the highest rates of maternal mortality, have disproportionately high rates also of hypertension, diabetes, and cardiovascular disease, and are less likely to receive first trimester prenatal care. Cardiovascular conditions are the leading causes of maternal death. So what women really need is quality care, compassionate healthcare professionals, support, and better health education. And as for the charge that women and minority groups face more obstacles accessing alternative options, please see below for a comprehensive list of ways to actually support women. It's so important to present women with the facts. There is no reason to live in fear. Throughout history and to this day, life-affirming physicians caring for pregnant women have always recognized that they have 2 patients, the mother and the child. I'm Dr. Monique Chireau Wubbenhorst, a board-certified obstetrician-gynecologist for Edify. If you liked my Edify video, you'll love this one next to me. Thank you for watching.